You're listening to a brief excerpt from Ways to Leverage Financial Tools to Optimize Digital Member Engagement, co-sponsored by Change Healthcare. During this webinar, Gary Word, Vice President of Network and Payment Solutions for Change Healthcare, and Irina Polsinelli, Product Manager with Aetna, discuss Aetna's approach to helping members manage their healthcare finances, as well as how financial functionality in the member portal can be used to improve member experience and provider satisfaction.
This is Gary Word with Change Healthcare. For those who may not have yet heard about us, we are actually now one of the largest healthcare technology companies. We have customers across the spectrum with services to providers, to payers, and to patients, to consumers. We have a very extensive network, a lot of data, a lot of connectivity, which I'll describe a little bit more on the next slide. And we have about 15,000 employees strong now that are delivering for the various products that we have.
Hi, this is Irina Polsinelli, and I'm representing Aetna today. I'm the product manager for one of the Aetna areas that works to provide our customers and users with healthcare and wellness tools. So many of you should know who Aetna is. We are a very large healthcare provider for insurance benefits. We have over 38 million memberships right now. And really overall, we offer a large number of different healthcare wellness offerings to our membership. We'll be talking about some of that today.
So how do we meet this demand that the consumers are having, and how do we actually use that as also a way of driving engagement? So the demand from the consumer is make it simpler, to figure out what they owe and how to make the payment. And because consumers do know, especially with the high deductible plans, that they need to actually make those payments, the easier you make it, the more they are actually going to be engaging with whatever the tools are that are used to make those payments. And the more online those tools are, the more ability you have to drive other aspects of the overall engagement that the consumer has with that online tool and the company behind it. So what are the current issues that consumers have when they're actually trying to figure out their payment? Is it time to pay? Now that sounds like a silly question, because when you get a bill from just about any company that you purchase something from, the bill tells you this is when you're supposed to pay. But in healthcare, we've made it different. We don't really know whether it's time to pay, because there's this other company, the insurance company, that is paying some portion, and then we need to pay the last part. So is it time to pay? Has the insurance company paid their part? Maybe I'll wait another billing cycle or two before I make my payment. How much do I really owe? Is what the provider tells me that I owe the same as what the insurance company is telling me that I'm supposed to pay? For that matter, what is this bill for? I went to the hospital for this one procedure, and I got all kinds of bills. Why can't they make it easier? Why is it so complicated? This is the kind of, these are the types of issues that we've found by having real discussions as we look for how to make the payment process easier for consumers. These are the kinds of things that the consumers are telling us during those interviews.
So one of the things that we have thought about on the Aetna side is how overall health finances and supporting our members and our users in managing their finances fits into overall health and wellness. It's very important for Aetna to provide our members with various tools to, not only manage their conditions and improve their health, but also make sure that their lifestyle is stress-free and that we can support them in any way possible. As Gary mentioned, health finances is a big stressful area for our members. We've done lots of generative research where we've gone actually into member homes and have talked to them about, finances, health finances, how they view their benefits, what their perspective is on understanding the claim payment process, as well as their responsibility. And overall, there's a lot of confusion in this area from our members. Obviously, the education level of how these things work varies from member to member, depending on how familiar they are with overall healthcare process. But the big takeaways for us were that we really need to help our members understand claims, the payment process, and support them in making the right decision in knowing when to pay a bill and what the portion of the bill they're responsible for, and providing them the tools to make this a really easy and seamless process. And, think about longer term, how to take this information and then help them optimize their benefits and become really fluent in health finances. So, thinking about these different areas, we've worked with Change Healthcare to provide some tools as a starting point that we think will really help optimize the information we have, on our healthcare side, which includes claims, EOBs, all the breakdown and timelines that we know of the adjudication process, and combine it with the payment experience.
You've been listening to a brief excerpt from Ways to Leverage Financial Tools to Optimize Digital Member Engagement, co-sponsored by Change Healthcare and recorded on October 16, 2018. You'll want to be sure to watch the full 1-hour webinar video. To do so, use the link to the full video, which also appears now on your screen.